like to say a word on a different topic that is certainly on everybody's mind, and that is the coronavirus. I was recently notified by my governor, Governor Pritzker, that we have run into a shortage in our state of the test kits that are necessary. Some 330 Illinoisans have been tested to date, and these are people who, on physicians' orders, should be tested either because of exposure to coronavirus or because of the vulnerability of the patient and the suspicion that they may have been exposed to the virus. The difficulty we've run into is that the testing process apparently is coming to a stop. We are running out of test kits. And there's been a contact made with the Center for Disease Control to determine why we're not getting responses on this need for additional kits in our state to test people who are truly vulnerable. I don't believe our situation could be unique. I imagine other states are facing the same challenge. I reached out to the Center for Disease Control within the hour and had a lengthy conversation about the situation that we are facing. Originally, the coronavirus test kits faced a shortage of reagents that were necessary to take the initial test. It turns out that we are now facing a new challenge. It's an issue of the global supply of enzymes that are used by laboratories to analyze the test results. This is a commercially available enzyme that is now in short supply, and CDC is desperately looking for other commercial sources that are reliable that can come to the rescue. The testing process, of course, is going to stop if the laboratories can't take the initial test results and test them to see whether they're positive or negative. They're looking for alternative ways at the CDC to meet this need. It is a critically important issue, and the lack of these enzymes limits the actual tests that can be taken across the United States. The source at the CDC told me this situation is not unique to our country. It is a commercially produced product, and they are looking for other sources, either within the United States or without, as quickly as possible. This is a market-driven problem, and the CDC is looking at across the market for sources to solve the problem. For the time being, there's no relief in sight in Illinois or other places that have run into the same issue, where people desperately need to be tested to determine whether they are positive for this virus, and the testing, even if it takes place, cannot go through the laboratory approval. The commercial supplies of this enzyme apparently are depleted at this moment. It's an urgent issue, as I mentioned repeatedly. They are looking for optional alternative platforms for this laboratory testing. Now, I would say at this point, I don't want to speculate on what that means. It's far beyond my personal expertise, but it's an indication of a desperate situation in many places. It's one that we need to respond to, and quickly. To argue that there are enough test kits that have been distributed is questionable to start with, but even if distributed and they cannot be analyzed, it really doesn't give us the information necessary to protect the Americans who may be vulnerable. The bottom line is this administration is facing a challenge with test kits that still have many unanswered questions. How did other countries in the world, Korea and others, come up with test kits early on in volumes that were necessary to address this problem, and the United States did not? Why didn't we accept these test kits in other countries that apparently do come up with results that are needed and necessary? I don't know those answers. Only time will provide them to us. But in the meantime, we have appropriated all the funds and more asked for by the Trump administration to deal with this issue on a bipartisan basis, and that's exactly what we should continue to do. But we need, start to finish, straight answers from everyone in the administration and outside about this public health threat. Credibility is the first step toward dealing with a public health challenge such as the one we face today. And this test kit issue is clearly central to our bringing this situation under control. The sooner we get straight answers and good information and can respond to it quickly, the better for our nation.